Yeah, thank you, Vicky. Appreciate that. All right, I'm just getting settled in here, buddy. So what I want you to do is, you'll see that there's a microscope about 6 inches in front of your eye here. Inside the microscope, there's a really bright light. And I want you to try to look directly at that bright light. Yeah, that's perfect. Perfect right there. It's a little bit to the right of where you're looking right now. Just kind of like that. Yeah, you got it. You got it. Beautiful. Thank you. All right, so we're going to give you a little bit of what we call lidocaine, phenylephrine, and that'll kind of numb the inside of the eye and dilate your pupil. It's going to sting a little bit as I do this. It might feel like cold water, might sting a little bit. What are you feeling there? Might feel like cold water. A little bit of both. Okay, great. What are you feeling there? Yeah, that looks really nice. So try to find that light again. Looking right into the microscope and looking for that bright light. It's going to be joined by 2 others. So you'll probably see 3 points of light. Yeah. It's going to be joined by 2 others. So you'll probably see 3 points of light. Yeah. It's going to be joined by 2 others. So you'll probably see 3 points of light. Keep looking directly at that bright light. So pupil's just barely big enough. Keep looking directly at that bright light. Can I get some irrigation? And also, I'm going to need a Connor wand to hold the eye still. Let's put him down for a block on the other eye. Yeah, thanks. Epithelium's loose, of course. This is a, you can see the epithelium is a little bit loose. Interesting. All right. You're doing great, buddy. Just keep holding real still. Even your feet need to be still, okay? We're gonna need to spiral this capsulorhexis out a little bit more. Pupil's small, so my tendency is to make it a little too small. But we'll kind of spiral around until it's the right size. I can get a hold of it. Okay. All right, let's do some hydro. All right, there's the hydrodissection, which kind of floats the lens up away from the capsule. You are doing great. Just keep looking straight ahead, okay? So here we're sculpting a groove. Ton, I'm kind of narrating for the video a little bit, so you may hear me like talking to myself a little bit. Just try not to be completely silent. Also, my son wore a tie today because he's gonna like pop up on a picture-in-picture and try to narrate what's happening in the surgery. Yeah. So we watched a video on like all about cataract surgery and all the various steps of it. So I'm kind of excited that he's excited. This it'll just be like a little picture-in-picture with his face and his voice. Yeah. Yeah. Well, it's actually his Halloween costume because he was a Hufflepuff. You know, from... Yes. So he has like this really cute sweater and a little preppy tie. It's adorable. Yeah.
Was there trick-or-treating last night?
Yeah, there was. You bet there was. We just like went up and down a block. Went over to a rich neighborhood and passing out full candy bars. So it's the way to do it. Right, right. It's about quality, not quantity. Well, I think for my kids, it's about both. Yeah. So my 6-year-old gets home last night, and the first thing he does, he goes up into the kitchen, and he does this before I'm even out of the car. I come up, he's got all his candy organized into a Ziploc bag. He's got a Sharpie, writing his name on it. And when I come in, he gives me this like sharp look, and he's like, I'm putting my candy somewhere where you can't find it, so you don't take it away, or you don't lose it like you did last year. Oh, the candy Nazi. Yeah, let's get some viscoelastic. Okay, so here we're filling the capsular bag with viscoelastic, which will cushion the arrival of the new implant. Good news, we got the cataract completely out without any difficulty whatsoever. Yeah, you're really doing great. I want to thank you for holding so still. You're absolutely the best patient of the day so far. Is that funny?
Yeah.
You hold the record. Yeah. All right, so we've got the lens in there now. It's you're married to your new lens. Then we're going to clean up that gel, close things up, and we'll be done. How are you feeling?
All right.
Good. You feeling calm? You feeling relaxed?
Yeah.
All right, so we're trying to clean up any little traces of stragglers here. Jack, do you think you'll watch this video later?
No.
Or you're not the YouTube watching type? Well, I don't know that most of my patients are, but did anybody come with you today?
No.
Well, okay then. How you getting home?
Hitchhiker.
Oh yeah, like a ride source or something?
Yeah.
I just see a little bit over here. Like there's just a little bit of lens material in there. Yeah, that looks nice. I think we're done here. Okay, so that's everything all sealed up with some BSS, balanced salt solution. Check the incisions and make sure that they're watertight. This is a little bit of antibiotic. It's clear, you can't see it, but it's killing germs. Okay, and then we've got a little depot of some anti-inflammatory medicine. We'll put down kind of in a little pocket under your eye. And this might feel like a little bit of a sting, but you might feel nothing, okay? Whatever you're feeling right now is normal. Any discomfort with that? Great. Okay, that is it. Have a good one.
All right, thank you.
Thanks, Todd. Thank you. Good case.